Developing research skills. How has the COVID-19 pandemic and online learning changed and affected children's development? Throughout this presentation, I will be creating a draft research topic for my dissertation project being implemented next academic year. The question that I'm focusing on is how has the COVID-19 pandemic and online learning changed and affected children's development? To answer this question, I will be implementing the following. Stating my research topic and explaining why I find it interesting, why I believe that my topic is an important topic to study, relevant literature, policy, and background linked to different COVID-19 online learning and children development, my research question and its justification, my research methods, approaches to my research and possible ethical issues, and the potential impact on policy, practice, and theory. According to the World Health Organization, the COVID-19 virus is an infectious disease caused by the SARS-CoV-2 virus. In March 2020, the British government decided to introduce a lockdown due to the rapid spread and severity of cases around the world of COVID-19. Introducing this lockdown, like many other countries around the world, meant that all non-essential sectors, including restaurants, shops, and leisure facilities, had to close, as well as public transport and abroad travel being reduced. The British public were instructed to stay and work from home. However, one aspect that people were not expecting to close was the use of schools and education settings, introducing to parents, guardians, students, teachers, and education leaders online learning and online teaching. The COVID-19 pandemic disordered and disrupted more than 1.7 billion learners across the world. When schools and education settings closed, there were only a select few of service users who were still able to attend schools in England. These students were classed as being in a vulnerable state, or their parents were classed as key or critical workers. In the study of early education and development, part of the data found shows that 89% of children who implemented the study did not attend school in person during the first national lockdown from March to May 2020. 85% of these service users had critical or key worker parents or guardians. In a study conducted before the COVID-19 outbreak and lockdown, there was found to be a high growth and demand for online education services, applications, and education technology. It was found that the global education technology market was worth $18.66 billion in 2019. It is suggested that by 2025, the global education technology market will be worth $350 billion, showing the demand for online learning tools and resources. SlideShare found that some funds that were planned for the use in the education sector were either reduced or significantly diverted into helping run the health sector and other aspects of the British government and its economy. In 2020, different countries who entered lockdowns implemented and were provided with different selections and varieties of online and remote learning resources, including educational radio and television programs, online resources, instructional packages, real-time lessons, and self-paced formalized lessons. The topic that I have chosen to research in this presentation is how has the COVID-19 pandemic and online learning changed and affected children's development? There are several main reasons to why I've chosen to research this topic. These reasons include: it will help me to gain a further understanding of how online learning can both positively and negatively affect a child and their development. It will allow me to discover different options and views of online learning and teaching compared to in-person learning and face-to-face teaching, both with students and educators. I will be able to compare students' experiences who have implemented online learning through COVID-19 and those who didn't. I'm interested to see what parents, guardians, and educators think of online learning and how they feel it's impacted students. Will online learning create issues in the future for other forms of learning or their development in students? Did students receive the same experiences in online teaching that they would have in face-to-face teaching? Some students have limited resources to continue their education. As a result, many face the risk of never returning to school or undoing years of progress made in education. UNICEF 2020. Why my topic is an important topic to study. I believe that my research topic, how has the COVID-19 pandemic and online learning changed and affected children's development, is an important topic to be researched and studied for several reasons. These reasons include: it allows people to gain an insight into how the COVID-19 pandemic has affected other people and their development. It allows parents, guardians, and educators to understand how their child or students may have been affected and the best course of action to take to help the child develop to the best of their ability. It can help to teach individuals on what can be improved if something such as a pandemic should happen again. It can help to plan next steps for supporting children's progress in ways that were not already thought of. It may create new ways of supporting the child in their development, which can then help the child to progress to their full potential. Child protection charity National Society for the Prevention of Cruelty to Children states that the development of a child is affected by various factors, including the environments they're raised in, the relationships they build, and the experiences that they have. The relevant literature, policy, and background linked to how has the COVID-19 pandemic and online learning changed and affected children's development. One study conducted by the Department of Education, the study of early education and development, findings from the coronavirus research report, found that in the national lockdown period of April to May 2020, 1 in 5 children in a disadvantaged group had no access to a computer, compared to 1 in 20 children seen in the least disadvantaged group. This meant these children were not able to complete tasks or implement online lessons or work set by the teachers. The study also found that according to parents who implemented the research report, 34% of children exercised every day, while 29% of children exercised 4 to 6 days per week. 34% of children exercised 1 to 3 days per week, and 3 of the children never exercised. It was found that 22% of children who interacted in the study received extra guidance in maths, English, or other academic subjects. The report also discovered that the additional tutoring for more than half of children involved, the extra tutoring sessions were organised by their schools. The study of early education and development found that all children who took part in the study were given work from their schools and educators to complete. The study found that 35% of the students were able to complete the assigned work. However, the study also found that children with special educational needs were less likely to be assigned work and also less likely to complete the assigned work. Bernard and Hobbs state that since the COVID-19 pandemic, the early childhood and education and care sector has been affected in certain different ways. This includes permanent setting closures, less of a demand for both early childhood education and care places and staff. Boland and Hobbs also state that before the COVID-19 pandemic and its lockdowns took place, the use of online learning or distance learning was seen more within higher education establishments such as colleges or universities, but was seen significantly less within schools, especially within the primary education sector. Throughout their research, Bolin and Hobbs found relevant evidence which shows that online learning, in some cases, can be more effective than face-to-face or in-person learning when aiming to achieve certain targets or personal goals. When implementing online learning, it is essential to ensure that learner engagement and motivation are upheld to the best of both the learner and the educator's ability. For this to happen, students need to receive the support of both parents, guardians, and teachers, as well as positive relationships with educators and peer-to-peer communication. Service users should also have access to a suitable, organized study space, as well as access to any resources they may need, including the relevant technology, textbooks, or other relevant information to implement and complete the work. It was found through the COVID-19 pandemic, educators struggled with finding the time to understand new digital ways of learning and different ways of approaching online learning. This was a common key barrier to teaching amongst educators. Lalani and Lee conducted research that proposes that using online learning can help to increase the processing, understanding, and keeping note of information, and helps the learner to understand information quicker. Due to these findings, both researchers believe that online learning may be implemented more through day-to-day teaching and learning. One study created by Champo, Majavaki, Marquetta, Overn, and Piccoli found that due to the global lockdown due to COVID-19 throughout Europe, lockdown played a stronger part in negatively affecting boys, children attending nursery, kindergarten, secondary school, as well as children of families who received and possessed a lower education level. In 2020, Schleicher found that it was essential that governments used appropriate funding to support disadvantaged students and service users. He states that learning and teaching should be constantly funded or regulated to ensure the best practice in education is being received. According to the Italian government, online learning support measures were put into place to ensure that each school and education setting had appropriate digital education platforms, applications, and tools to ensure the best outcome for students while learning at home. Students who were disadvantaged were also able to borrow digital technology, which allowed them to receive the same educational experiences and obtain the best chance of development while in lockdown, without receiving any discrimination or judgment. Moreover, teachers, educators, and other staff members were taught how to efficiently use and trained with appropriate teaching techniques for online learning. My research methods. When conducting my research, I will be using a range of methods to expand and understand relevant information and opinions to support the question, how has the COVID-19 pandemic and online learning changed and affected children's development? The methods I will be using to conduct my research are interviews and surveys. This will allow me to gain relevant knowledge and first-hand experiences on my research topic while allowing individuals to give their own thoughts, feelings, and opinions. When looking at implementing my research methods, I will be using the following individuals to create a fair understanding and fair results from my research. The people that I will be using to collect my data and information include children aged 8 to 11 or those in Key Stage 2. This will allow me to gain first-hand opinions and understand the different experiences and opinions on how young children feel that the COVID-19 pandemic and the change to online learning has impacted their development. Teachers and educators. This will allow me to gain first-hand knowledge on how educators feel that the COVID-19 pandemic will play a part in children's development, as well as their thoughts and opinions on the impact of online learning while using the same teaching methods, as well as finding out how educators were able to adapt their teaching styles to suit online learning while providing support to both students and parents. This will allow me to parents and guardians. This will allow me to understand how parents and guardians feel the change to online learning has impacted their child's development and provides an option to give their opinions and thoughts on the situation. They can also provide and compare their education to current times. Possible ethical issues when conducting my research question. When conducting my research question, there may be some ethical issues that I face. Despite thoroughly planning my research, there may be an occasion where an ethical issue may arise. To avoid this from happening, there are a number of actions I will put into place to prevent this. These include how to create a positive experience. I will create a positive experience by asking only simple, relevant questions which the individual can understand. For example, when presenting my research question to younger children, I will ensure that they have their questions presented to them in a simpler way compared to their parents, guardians, and educators, meaning that they can understand and interpret the question and provide a relevant answer. Safeguarding. To ensure all participants are receiving the highest level of care throughout my research topic, I will ensure that every individual and their confidentiality is protected. This will allow every person implementing either interviews or surveys to feel safe and not discriminated against when partaking in my research and providing their answers, allowing them to answer freely and without obstruction. I will ensure that safeguarding is met by not asking for personal information or details such as names, addresses, or contact information. In the case of needing any of this information, I will ensure that the individual is made aware and their details are kept secure in a file that only I have access to. Sensitive topic. With the research topic that I have chosen, there may be some individuals who have had a negative experience throughout COVID-19 and the pandemic. Despite my research question being solely about child development and online learning, the question may be a sensitive topic for some individuals. For example, they may have lost family or friends who contracted COVID-19 or may be part of a disadvantaged area, meaning that they were not able to implement work set by schools and educators. Taking part in my research question may also lead to individuals experiencing bad memories, thoughts, or experiences, and this may have a negative effect on their mental health. Potential impact from my research topic. After conducting my own research on relevant policies, practices, and theories that could have potential optimistic impact on my research question, I have concluded that once implementing and on completion of my research question, there are ways that I could have future impact. This includes creating policies within schools and education settings to provide teachers, educators, and other staff with the relevant training to ensure online resources are used to their maximum capacity and ensure service users are receiving the best education and chance of development if a global lockdown should happen again. Both government and education settings can provide different forms of information to parents and guardians to help promote positive ways to support their child's development, whether it is through valid information to ensure that technology is used to its full advantage at home, online learning tips to get the most out of learning from home, or providing positive material to ensure the best physical, intellectual, emotional, and social development of the child. After the research and statistics that I have found on children who are unable to implement set tasks and schoolwork by their teachers in the global lockdown, I believe that the government could use this information to either directly work with disadvantaged families to provide them with the relevant and needed equipment and technology to provide a fair chance on children reaching their best development abilities. Otherwise, working with services such as schools and libraries to provide chances and experiences for disadvantaged families to either rent or borrow relevant technology to ensure they are able to finish work that has been set to be completed at home, or these settings could provide sessions to children and their families to come into the service and use the equipment provided. With the use of online learning and the relevant applications available throughout technology, teachers and educators will be able to incorporate the cross-curricular approach into learning in their lesson plans.